Hi, I'm Dr. Noel Richardson. I am Director of the National Centre for Men's Health at IT Carlow. I'm delighted to introduce you to a really exciting, innovative research programme in farmers' health called on Feirm Ground, and to PhD student Conor Hammersley, who will talk to you in more detail about the programme shortly. Just by way of context, the National Centre for Men's Health has been working closely with Teagasc and other partners in the farming industry on farmers' health for a number of years now. We know that farmers face significant challenges in relation to their health, and we also know that agricultural advisors are uniquely and strategically positioned to support farmers on a range of issues, including potentially health issues. So our main focus in this study was to explore the potential for ag advisors to assume a type of health champion or health connector role. Not, it should be said, to assume the role of health professionals, but rather to signpost and connect farmers to services and supports, to normalise and mainstream conversations on health into routine interactions with farmers, and to be a link or bridge in terms of connecting farmers to services and programmes locally. So Conor will describe in more detail the first phase of this study, findings from discussion groups with farmers, ag advisors and others about how this might work in practice. Just to conclude, from my perspective, I really want to acknowledge the highly innovative partnership model that underpinned this study. To my knowledge, this is the first study to be co-funded by the Department of Health and the Department of Agriculture, Food and Marine. Other parties include the HSE, Teagasc, WIT, the Men's Development Network, and ourselves here at IT Carlow. And because a project such as this inevitably straddles policy, research and practice, I think the nexus or catalyst for bringing these domains together and bringing the project to life essentially has been this unique partnership model. So, onwards and upwards.
The beauty of Ireland's landscape is legendary, and predominantly an agricultural one, and farmers have been its gatekeepers for generations. Traditionally, farm safety has dominated farmers' health literature, and for good reason. This project, titled On Feirm Ground, developing a national farmers' health training programme targeted at agricultural advisors in Ireland, aims to broaden out that focus to a more holistic focus on mental and physical well-being. So in brief, this is about training up agricultural advisors who meet farmers on a regular basis to equip them with the skills and competencies to be able to engage with farmers on topics associated with mental and physical health. So my name is Conor Hammersley and I'm the PhD researcher on this study, and the background of this project is that there is a substantial body of evidence that suggests farmers experience a disproportionate burden of health problems, particularly in relation to mental health problems, as farming is one of the highest occupations associated with suicide. Additionally, due to the isolated nature of farming, farmers are seen as a hard-to-reach group. A key asset that we have is that agricultural advisors are uniquely positioned to support farmers on health issues, and our findings suggest that although they report encountering health problems, particularly in relation to mental health problems, they feel ill-equipped in their capacity to engage with farmers on these matters. So our study is broken into 4 distinct phases, and the first phase of that, which I am going to discuss in this presentation, is an exploration study of farmers and other key stakeholders' experiences and perspectives in relation to farmers' health and help-seeking behaviour, and to provide clear, actionable recommendations to inform the design of the training programme. The title of this study is The Most Important Cog in the Wheel, Prioritising Farmers' Health Through a National Training Programme. And this quote, the most important cog in the wheel, was a quote from a focus group participant, and it was used in the context that farmers had lost sight of this. They had lost sight of the fact that their health is the most integral aspect to the overall welfare of the farm, and rather their inbuilt mindset was to soldier on and stay strong in the face of adversity, and put everything else above looking after themselves, as illustrated in the following comment by one female farmer. You know, there was this conscious thing, if I was going to get my hair done, I was selfish. To go to the doctor to check something out, I was selfish. You know, because maybe you're only looking after yourself and not thinking of other things. The findings of this study are based on the analysis of the focus groups that we conducted with farmers, different farming organisations, agricultural advisors and spouses of farmers. So what did we find? Our findings are broken into 4 distinct themes. The first one is in relation to farming, rural masculinity and identity. And this is against a backdrop of farming being a male-dominated occupation and traditional masculine norms standing in the way of farmers engaging in their health. Our findings suggest that farmers' identity revolved around the farmer as a hard worker, battling against environmental and economic obstacles and exerting his authority over the natural landscape, all the while suppressing emotions and help-seeking behaviour. There was a sense that real farmers don't ask for help, that seeking help was like an admission of failure and had an emasculating effect on the traditional norms that farmers felt they had to live up to, with one male farmer saying, "I would say the old perception of we are hardy and we are men and we are okay, we don't have problems, that's the perception." There was relational aspects of farming and rural masculinity, whereby the female of the household was seen as the custodian of farmers' health, and this would defer responsibility away from the farmer when engaging with health. Health was seen as female business and not something hard-working men had time to engage with. The second key theme was in relation to wrestling with the challenges to autonomy and control within farming. Succession and inheritance was repeatedly referenced as a key stressor in the focus groups with farmers. A number of tensions bubbled under the surface, not least the insecurity and lack of autonomy associated with not knowing if or when the farm might pass from one generation to the next. Changing farming roles and increased paperwork, and farmers struggling to keep up with this, particularly felt amongst dairy farmers, who had increased in the scale of their farm, and older farmers, who were struggling with the evolving nature of farming from a physically labour-intensive role to more and more administration work. It was felt that farmers were being held to account more and more by regulatory authorities, with one farmer saying, "Before, as long as a fella was good with a brush, shovel and 4-grade fork, he classed himself as a farmer. But now it is an office job. Everything is more accountable now, and it all comes with deadlines. And if we don't meet them, we are severely penalised. Older farmers especially, they are terrified to make any mistake." The third key theme was in relation to isolation and the broader demise of rural communities. The unravelling of mehel in rural communities, that sense of mutual support and communal way of working, which were once the traditional hallmarks of a rural community, had been lost. There was a perception in many of the focus groups that everyone was simply too busy to be helping one another out, with one agricultural advisor saying, "Before, it used to be over and back with farmers helping each other out and pooling machinery. All that is gone now. Lads are just too busy nowadays to be helping each other out, and that has really affected farmers' mental health." Added to this was the growing concerns in relation to isolation and the subsequent feeling of loneliness that came with this. Isolation was associated with a loss of perspective, as the isolated farmer did not have anyone or anywhere to unburden his or her difficulties. As a result, problems did not just remain unresolved, but rather intensified, festered and became amplified over time. And the last key theme is in relation to defining a health role for advisors, roles, responsibilities and boundaries. Firstly, there was a strong feeling among advisors that they have an inherent duty of care to farmers, and there was a strong sense that they could play a more holistic and meaningful role in terms of not only helping farmers with the welfare of their farm, but also engage with farmers on the welfare of their health. In relation to some of the obstacles that advisors alluded to in assuming a health role, as you can imagine, there was a feeling of apprehension or a fear in relation to broaching health topics with farmers, particularly in relation to mental health. Finally, in relation to minding the minders, advisors described their own vulnerability in relation to being exposed to potentially sensitive or intimate situations, which in the absence of training, they would feel ill-equipped to be able to deal with. So just to conclude, and some of the considerations deriving from this study, it is important to understand and acknowledge the role identity and masculinity plays when engaging farmers on health topics. It is also important to understand that farmers are not an homogeneous group, that they vary in terms of geographical location, farming enterprise, age profile, gender and marital status, and all these variables will implicate in diverse ways with farmers and their relationship with health. From my experience, a key aspect of engaging with farmers on health is on creating a safe space and empathising with the world of farmers. In all the discussion groups that I conducted with farmers in relation to health topics, I never came away feeling that farmers don't engage with this stuff. Rather, I came away from all the discussion groups with a feeling that if the safe space is created for farmers, they're more than willing to open up and share their story. And that is the challenge, creating that space. Granted, I used the word farmer throughout this presentation, but solely identifying these people by their occupation does not do them justice. They are family members and they are community members. They are part of our sports clubs, our tidy towns teams and other rural organisations. They are the people we meet down the local shop. They are the very essence and fabric of a rural community. And too often these people, particularly men, fall ill or more severely pass away due to the fact that they are not comfortable in going for a health check, or feel it is not the manly thing to do to talk about some of the difficulties and emotions that they are dealing with. Farming is one of the highest occupations associated with suicide, and that is the impetus for this study, to understand and break down the barriers associated with farmers engaging with their health. Finally, I would just like to say a special thanks to all the farmers, farming organisations, agricultural advisors and spouses of farmers who took part in this study and shared their experiences and stories with me. Without them, this study would not have been possible.